You also talked about specific carbohydrate diet and how that helped you. Can you go a little bit into that? Because a lot of people hadn't heard of that diet before.
Sure. So breast cancer 25, got through extensive chemotherapy, 3 drug, which destroyed my gut. And that's where the Crohn's comes in. 6 months later, I was having cyclical fevers, abdominal pain, bleeding, diarrhea. And I woke up in the ER after I passed out. I was working in the ER, passed out in the ER, woke up in the ER as a patient. And then I went to surgery that night for an emergency. I had an abscess infection and came out the next day. Doctor's like, you have Crohn's disease. So I was like, what in the world? I just got over cancer. But it makes sense because the chemotherapy creates more permeable gut. Permeable gut in someone with genetics that cause Crohn's, which I have, means that my microbiome, when it started leaking into the bloodstream through the permeable gut, triggered an autoimmune response, which created an abnormal response on the lining of the gut where my body attacked my gut lining, and there is Crohn's. So what do I do, right? I saw a gastroenterologist a week or 2 later to get the diagnosis and figure out what to do. He gave me a really depressing spiel. He said, this is lifelong. It's incurable. You're probably going to need immune modulating drugs and steroids all of your life, and maybe part of your colon removed. I'm like, great. And then I ended with this. I was like, doc, and I was purely innocent. I didn't know any better. I just like, does diet have anything to do with it? I want to do what I can. And he did not pause. He just like, Jill, diet has nothing to do with it. But back to the intuition, even at 26 years old, I was like, that doesn't seem right. Like, how in the world can diet have nothing to do with the gut? So I was like bound and determined to prove him wrong. And I went on a search and I found Elaine Gottschall's book that's from the 70s or 80s. It's not a new book. And she talks about specific carbohydrate diet for treating ulcerative colitis. She first found it in her daughter. There's another doctor, I can't remember his name, who showed her. And then she started writing about it because it really completely put her daughter into remission. So bottom line is this. With Crohn's and colitis, I know this well now. Often there's overgrowth of bacteria, as we mentioned, especially SIBO, small intestinal bacterial overgrowth, and SIFO, small intestinal fungal overgrowth. In fact, what many people don't know, and doctors do, but they don't put it together, the Crohn's panel we do on any lab is actually anti-candida, anti-saccharomyces, which are yeast antibodies, and it determines the severity of the Crohn. So if you have anti-yeast antibodies in your body, which means you have a colonization of yeast, the Crohn's is more severe. And again, docs are checking these things are called ANCA or ASCA, AMMA, et cetera. And they're like, yeah, those are antibodies. They're not thinking that those are actually yeast antibodies. So maybe we should treat the root problem. All that to say, the specific carbohydrate diet eliminates certain disaccharides, so double molecule of carbohydrates that will feed the SIBO and the SIFO. So it's almost like a type of FODMAP diet where you're eliminating the precursors that are going to trigger that overgrowth of bacteria. And so it works really well. And my story was I went on this, didn't know any better. I also went off gluten, which I didn't know that trigger was there too. And within 2 weeks, my fevers, my symptoms were gone. Now, it took me a couple of years to really heal from Crohn's, and I consider myself today, I don't have it anymore. It's cured. So
beautiful. Yeah. Food is medicine. We have to believe that too.